Pope Francis battled several health issues before his death. Most recently, a 38-day stay in a hospital being treated for double pneumonia, remarkably seen just yesterday at an Easter blessing, just hours before his death. Dr. Darien Sutton joins us now with what you need to know, and it's good to have you on, Doc. Let's talk about it. Talk about his treatment when he was admitted to the hospital back in February.
Well, I think it's important to start with, of course, as a physician, I wasn't involved directly in his medical care, but as you know, I was closely following his health journey and recent hospitalization and reporting on it. So for the Pope's story, it started with an episode of bronchitis or an inflammation of the lungs that then progressed to a pneumonia or an infection of the lungs. And DeMarco, this is one of the most common reasons patients are hospitalized. The American Lung Association reports at least 1 million hospitalizations each and every year. His hospital course was complicated, however. It was complicated with an inflammatory or immune response that resulted in asthma-like symptoms that required aggressive intervention and at times oxygen supplementation. But remarkably, he was able to withstand that, recover, and be discharged from the hospital and begin his journey of rehabilitation.
He also had kidney issues as well.
Yeah, the kidney issues as well. Unfortunately, as patients are hospitalized, especially those patients who have a higher risk, especially for those patients who have a complex medical history, as a pontiff has had, that can also be, unfortunately, a factor that then dictates their outcome.
Certainly some serious health risks, but then yesterday we saw him right there in St. Peter's Square. He spoke briefly, and I think for a lot of people, they're very surprised this morning to wake up and learn of his death after such a public appearance. You, as you say, are not his doctor, but what does this say about his condition?
It's just simply a reminder of how tomorrow is not promised. I think that's something really important for all of us to take away from that. And also, I think it's just important to understand that he had a high-risk history. We talked about it somewhat before. He's had a history of a lung resection or a part of his lung being removed, prior infections, and that can increase your risk of scarring. And then these reasons are reasons why, number one, as physicians, we are so dead set on making sure that we understand specifically a medical history, because we understand how that translates to outcomes, and also the reason why his medical team was so cautious and closely monitoring and guarded with his care.
And we're looking at these images of him. Again, he was in the Pope Mobile delivering that blessing. And once again, you know, the Pope of the people. Yeah. And we've heard from people how important it was for him to be there among the people during this Holy Week. But as a physician, again, just describe the strength that it had to take for him to be able to, in his condition, be able to get out there and participate in the activities like he did.
A tremendous amount of strength. 38 days hospitalized. It requires a tremendous amount of strength and dedication to continue your work after something like that. I think it's a testament to how much he cared and a testament to what his purpose was and what he wanted his legacy to be.
Dr. Darien Sutton, thank you so much for joining us.
Of course.
We really appreciate it.